This is BoomerLife on CL 650.
And welcome back to the show. We're talking about getting a good night's sleep. If you sleep better, you live better. And we have Dr. Charnel Muir, the SnoreDentist, in studio. And the website is SnoreDentist.ca. Very easy to learn. As I mentioned earlier, a stroke of genius coming up with SnoreDentist.ca. We talked about CPAP machines and people with apnea, and apnea doctor, apnea dentist wasn't as catchy.
No, it doesn't sound as good, does it? No.
Now, we'll talk a little bit about people who are just loud sleepers and snoring. Is it usually the partner that drags them to you?
Yes.
And they're the happiest.
Yes.
Because as I always say to my wife, I don't know that I snore. I never hear it because you're asleep. Mm-hmm. But for the person that's, and the other one I hear is if I can get to sleep before the partner, then I'm okay. If I can't get to sleep before the partner, then all I hear is the snoring. So you get this, you've heard all these stories.
All the time. Yeah. All the time. No, I just had a husband in the other day, and he was returning one of the monitors that we had dispensed to test the breathing of a patient. And he said, "You have no idea. I have to give you a hug." Literally, he said, I had no idea that she was going to be that quiet, that fast. And I actually was worried she wasn't breathing.
Oh, really?
Yeah, because she was so quiet.
Because the breathing is a signal that you are breathing.
Yeah. Yeah. So,
And he says, "Do you have one for the daytime?"
Yeah. No, I haven't had that yet.
Yeah.
No.
That's called duct tape. Now I'm just joking. Anyway, we're getting way off this. So we mentioned you obviously get thank yous because people, you've changed their life.
Yeah.
And they're getting nothing like a good night's sleep. And you go through the day, you feel great. So let's have one or two emails that you've received.
Well, we had talked earlier about patients that have both appliances or CPAPs, or do people switch and back and forth. And I've got a couple here of patients that weren't able to tolerate the CPAP. So this one here is, I just couldn't tolerate the CPAP. They pulled it off in their sleep, which is quite common. Mm-hmm. People will take it off in their sleep. But the oral appliance worked immediately. I can fall asleep with the appliance in. I don't snore. My wife is happy. And it's really exceeded our expectations, because some people do go in saying, I don't know that it's going to work for me, and I'm just not sure. And you can't try it. It's custom made, right? So it's so refreshing when people then let me have that feedback, because some people are they almost disappear. They're so happy. They don't think they should come back and tell me. They don't think they should come back and have follow-up testing, because their whole complaint is gone. Yeah. Right? They're instantly happy. So, we get that kind of feedback from patients all the time. And this is another one that patients will often say to me is, well, I should be able to wear an oral appliance really easily. I wear a night guard anyway. Mm. So people will wear a night guard for grinding or clenching.
So what happens in that situation where somebody clenches their jaw or wears a night guard? Can this sustain that?
Yes. So this does both. So this will protect their teeth against grinding and clenching and keep their airway open. And in some patients, we actually see the grinding and clenching goes down, because the grinding and clenching can be part of protecting the airway. Mm. Some patients will clench at night to brace the airway to help keep it open. So they may actually notice they don't grind and clench anymore. And the other thing is that, people will say, well, I wear through my night guard every year. I grind through it all the time. But that's because they have teeth against plastic. And with these appliances, it's like against like. I've got an upper appliance and a lower appliance, and they're both the same material, so you don't wear them out, right, even if you do grind on them.
Because your teeth are very strong.
Yeah.
Now, with the airway being open and your jaw slightly forward, I'm guessing that people have fallen into different patterns of sleep and in the position that they sleep. They avoid sleeping on their back, because they maybe sleep more, and that's when they get the elbow and the ribs.
Yeah.
So do they come back to you and say, I have a much better range of sleeping now? I can sleep on my back, I can sleep on my side, I can sleep anyway.
Yes.
You get that?
Yeah, especially if they've been trained to side sleep. And, they've had the elbow therapy for years and years and years. As a matter of fact, we had a patient in just the other day, and it was probably at about 3 months of wear that they reported that there was a little bit of snoring again. And we figured out what it was it took him that long to be able to sleep on his back again because he'd been so trained to sleep on his side. And then, of course, when he slept on his back, his airway was more at risk. So we adjusted for the back sleeping at that point, and everything was perfect. So people like the fact that they can sleep in range of motion, like they can sleep in any position. They like the fact that they can pop it in if they fall asleep on a plane, for instance. I mean, it's easy enough to wear. If you're on a plane and you're flying for 7 to 10 hours, you're going to get some sleep in there. So people really do like that part, yeah.
The portability.
Yeah.
You throw it in your bag, and your carry-on bag, and away you go.
Always in carry-on, right?
Yeah.
Always treat it like medication.
Right.
Don't put it in checked bags. Checked bags will actually...
If you have medication, they will lose your bag.
They will
guaranteed.
lose it. We had a lady that had her bag go missing from Vancouver to Hawaii. They never found it. We have no idea where it is. And she had just thrown her whole bathroom kit in there and not even thinking about it. And sure enough, it was lost.
I had a flight. I was going to Germany, I believe, and there was a stop in Montreal. And I take an acid pill every day, and I forgot to take it. Well, it was in the suitcase, in the belly of the plane. So I called Air Canada's concierge line for frequent flyers. And I said, is there any way somebody can go in the bottom of the plane and pull my bag out? Well, they did. They went down there, they pulled the bag out, and they put it on the carousel. So I had to go out of security, get my acid pill, recheck my bag, and then get back on the plane.
Well, at least they did it for you, though.
Yeah, well, that's what I'm saying. I mean, not everybody has access to the concierge, right?
No.
So always take your...
Well, not everyone flies around the world like you do.
I know, but sometimes I have to tell you that I am conscious of when I'm flying that I do snore. But then I think everybody's got headphones on and the airplane's so nobody's going to hear me. But I have had people next to me on the airplane snoring, and they can be really loud.
Yes. I mean, I've heard them through hotel walls, when you're traveling.
What's the worst story you've ever had? The worst patient you've ever had for noise? Can you remember that person? Like they were so noisy that everybody
I have patients that admittedly have to sleep 2 floors apart from anyone.
Really?
So the bedrooms are upstairs
and
they're basement, and they have a 3-story house.
Wow.
A townhouse.
Wow.
That 2 floors isn't enough. They have to be the 2nd floor away.
I remember in the news there was a woman who had no hearing in one ear because her husband snored so loudly. She had lost hearing in her ear.
Wow.
Because of that.
Yeah. It really it's so disruptive, and it really also can have health consequences. But it's really, really disruptive to vacation and family life and everything.
It's one of those things. We have Dr. Ted Venom on about hearing devices for hearing aids. And he says that, losing your hearing affects other people because you're always having to repeat, what did you say? You don't hear. And I'm guessing snoring is similar to that, is that it's something that affects other people. So if you have somebody in your life that snores, you're not getting a good night's sleep either.
No.
Right? And do you ever get people who say, I hear him stop breathing and they can't fall asleep because they have this tension,
worried all
right?
night.
They're worried all the time.
They're worried all night. And they count. And they count how long that person doesn't breathe, and then they push them. Mm-hmm. They get uncomfortable with how long it's taking. So they stay awake at night to keep the other person breathing. Yeah, no, we see it all the time. And really, like we talked about, as a new year, starting the new year, what can I do to make my home life better and my own health better? really getting that looked at is important.
So what part of the spectrum should you be coming to the snore dentist? If you snore?
Yep.
If you snore?
Especially if it's not situational snoring. Like everybody will snore in a certain situation. They have a cold, their allergies flare up, they've had a couple of glasses of wine. That can be considered normal situational snoring. But if you've become a habitual snorer and you snore every night or most every night, you should have that looked at. That's common. It's not normal.
I guess get the laptop open. I should be making you're always on me every time when are you coming in?
I know. Right? Like it's something that we just let slip by.
Yeah.
We just let it slip by.
Because we consider it normal.
Yeah.
But you're saying it's not normal.
Yeah. Or it becomes the butt of a joke.
Yeah.
Or it becomes, well, my grandparents did it and my parents did it, so I'm just bound to do it.
And all that turkey we had over the holidays.
That's right. The overindulgence and the alcohol and everything over the holidays. It just, can make it so much worse. The
Snore Dentist is Dr. Charnel Muir, and the best way to get in touch is to go to SnoreDentist.ca. How easy is that to remember? And you can actually book an appointment online to go and visit Dr. Muir in North Vancouver. And if you are maybe listening outside of the Greater Vancouver area, say on the island, you can call and find out about appointments maybe over Victoria Way, Nanaimo.
Absolutely. And if I'm not in the office, I always have an answering service on, and they will take your information, and I will get that information within 24 hours.
All right. Thank you so much for being on the show. You're great at this. You got a new career in radio.
It's so much fun. You know what? I love what I do, and it's just so much fun.
Well, it certainly shows. Dr. Charnel Muir, thank you very much.
Thank you.
SnoreDentist.ca is the website. I'm Jack Spencer. Thanks for listening, and don't nod off. Keep listening to CL 650.